introductions and thank you. Joy Hart will kick us off and with introductions and give us an overview of the BHA. Our esteemed partners, Joe Tom with Division of Criminal Justice and Perry May with CDHS will talk about their involvement with the project. Then we will review the program information side of Senate Bill 22-196. Contracting team will give an overview of the contracting processes. Questions and answers at the end. We will please ask you to mute yourself and write your name and organization in chat when you have a question. Jenny or Joy, sorry.
Okay,
Joy.
I'll go ahead and go to the next slide. Welcome, my name is Joy Hart. I'm the Division Director for Statewide Programs, and I'm stepping in for our Deputy Commissioner Summer Gather-Cole, who was not able to be here this morning. I would like to introduce you to Perry May, who's the Executive Director of Health Facilities for CDHS, Joe Tomey, who's the Division of Criminal Justice Executive Director, Kayla Martin, who is the Contracts Procurement Manager at the Behavioral Health Administration, Iona Eggert, who's a Procurement Specialist, Team Lead for our BHA, Jenny Wood, who is the Director of Criminal Justice Services for Statewide Programs at the Behavioral Health Administration, and special thank you to Melissa Morales for providing our support. We're going to go ahead and do an introduction back over to Perry, and he'll describe his involvement in this legislation. Perry?
Great, thanks, Joy. Welcome, everybody. Thanks, everybody, for being here. So this is a very exciting moment for many of us who were involved in the shepherding of this legislation through the legislature last session. And I wanted to just talk about sort of some of the intent behind it. You know, certainly we all understand that there are people who bump into our criminal justice system who really need mental health care, behavioral health treatment. And so one of the ways we wanted to try and swim further and further upstream, if you will, in trying to get folks into services as early as possible, and as early as, you know, they're hitting the criminal justice system, or at any point they're hitting the criminal justice system, is to provide services, innovative best practice services that we've all, I think, learned about over the years in terms of deflection services, redirection services, and diversion services. So I'll give one example. You know, many of us have learned about some of the models that come out of Florida, where they have evaluators going into the jails every day and are assessing each person that came in the day before for what's going on with them, and do they need mental health services, and are they willing to engage in mental health services or behavioral health services. And then if they are, then having all of that information available to everybody when that person goes before the judge, and being able to make an informed decision about what the best path moving forward is. So as I said, this is a very exciting moment. We have a fair amount of money here for us to begin trying to implement some new exciting best practices to ensure or to move us down the road on ensuring that people who need mental health services are getting those and aren't unnecessarily at times caught up in the criminal justice system. So very excited to be here. My role moving forward, CDHS will have a position on the grants award commission or board, and some of that will be, so we'll have somebody on that board that will be looking at all of these best practices and figuring out what we're able to fund. So very exciting moment. I don't think Joe was able to join us, so.
Can you hear me?
Oh, there's Joe. So I'm going to pass it to Joe.
Thank you. Sorry, just a little bit delayed. It's really exciting to see 150 people on this call. I'll introduce myself. I'm Joe Tomey. For those of you I haven't met, I'm the Director of the Division of Criminal Justice over in the Department of Public Safety. And Perry, like usual, your eloquent introduction, you kind of stole so much of my thunder. I'll be able to go pretty quickly. A couple of years ago, we were noticing as a state the crime trends as the data started to reflect these adjustments during COVID. And it's like, how can we make something this, an emergency like this, turn it into a critical moment that really can improve the way that we work with the folks that are at risk in the system and that we want to keep out of the system. So the executive branch, General Assembly worked together and created a number of grant programs, a handful of which we're partnering with other agencies that come through the division here. And many of you have probably applied for some of those grants. To me, this is sort of a sea change in Senate Bill 196, in that it is establishing and starting to, no pun intended, institutionalize the concept that so many of the people that come into the criminal justice system and the way that they step into it through the processes of intakes, referral from law enforcement, et cetera, the acknowledgement that they do need to be held accountable for those actions, but aren't we responsible as a system of care, a system of support to ensure that they get the resources and are deflected to the resources they need. So we're hopeful that this becomes not only a grant program, but the opportunity to test what works and to become a permanent philosophical change or improvement in what's going on in Colorado. Many of you on this call actually either passively based on your reputations or actively based on conversations with us as there was bill work going on, establish the principles that we'll be using for this program. So hopefully your DNA will be reflected in what's going on. And again, it'll be a permanent strategy. In terms of role, I share the same role that Perry does over there. Here in DCJ, we're going to be contributing to the grant individuals to the sub-grant review process, the grant review process. And I'm fortunate enough to be able to provide some feedback and help shape what this might look like so that it will overlap and find a comfortable relationship with the other grant programs that are going on. That's another thing. It would be is that we want to see in the manner of normally, grant programs kind of go down their individual paths, but as we start to bring advisory groups together that overlap, maybe we can develop a more comprehensive singular blueprint that the grants support instead of a grant strategy that is basically going out and just funding individual ideas. So I told you I was going to be short. I guess I made that up. Apologize. And I'm really excited. There's so many. It's now up to 163 participants. This is intimidating and fantastic. So Joy, I think I got to get out of your way and you're taking the helm again. Thanks so much, folks.
Thank you. I'll take the next slide. A little bit about the BHA, the Behavioral Health Administration. We are new cabinet member-led agency within the state of Colorado, housed within the Department of Human Services and designed to be the single entity responsible for driving coordination and collaboration across state agencies, as you can see with our partnership expressed already this morning. To address the behavioral health needs, coordination within behavioral health efforts. We're coordinating and providing an opportunity to streamline our overall systems, and so that we are smarter about investing our dollars and more responsive to the needs of all people in Colorado. We want to elevate the needs of individuals and family members with lived behavioral health experience, improve transparency, cross-sector data, and stronger accountability in the system. Address behavioral health disparities with equity central to the mission of the BHA. Problem solve and implement solutions through collaboration and effective relationships. And engage the entire behavioral health system, including the commercial system, for prevention to recovery. Enhance and focus on whole person care. And improve the quality of care for complex populations like we're talking about today. Strive to be diverse, inclusive, and equitable entity in vision, strategy, and operations. And I am very pleased to pass this over to our Director of Criminal Justice Services at the BHA, Jenny Wood.
Good morning, everyone. I feel like I get the most exciting part of this presentation. I am going to talk to you about Senate Bill 196 and what the funds can be used for. Now, before we jump in, I want to just make sure we all have a common understanding and I'm not throwing out words people don't understand. So when I mention bill and legislation, I'm referring to the act that was introduced and passed by the state legislature. When I refer to grant program, that's the funding that was allocated out of this piece of legislation. And just to set the stage, the bill was signed into law May 19th, 2022. So it's still relatively new. And for those overachievers out there that may have already read the legislation, and for those that have not, I strongly encourage you to, because it is all specifically laid out if you did not take diligent notes today. But for the purpose of today, we are going to focus on Section 2 of the legislation. That is the piece that has the funding component for this program. So as a result of this, I hope you're all sitting down, which I'm sure you are since you're on Zoom. The BHA will have funding for community grant programs to the tune of $49 million. It's more than 49, but math is not my thing and I will botch the numbers. So that is unprecedented and extremely exciting to have that level of funding in our system to help individuals in need. I've been around for a long time for where we were all fighting over funding. Now there is an extraordinary amount coming into our state, which really shows the priorities to help people in need. There's going to be a competitive process for these funding, for this fund allocation, and some of the things, the goal in a nutshell of this program, 196, is to create community response programs for people facing a behavioral health crisis to really prevent arrest and unnecessary involvement in the criminal justice system if there's no immediate threat to public safety. The end goal is really to get people the needed care, not the cuffs. Now, with that said, we recognize public safety is a priority and arrest needs to happen from time to time. Guess what? You still get to apply, even if you have to arrest someone. The funds are going to be available to post-arrest programs with the caveat that individuals are redirected from the criminal justice system to community-based services. Funding's also going to be available for those where those individuals where competency has been raised. Some of the things that we can use the grant funds for, and I'm going to commit one of my presenting faux pas, I'm going to read through a list because there is a lot here. And I do not want to leave anything out because it's really exciting, the array of services that can be supported through this. So first, support, create, and expand pre-arrest and early intervention programs. We're really taking an upstream approach and ending the revolving door we know that has historically and unfortunately existed for those with behavioral health needs entering the criminal justice system. Funds are going to be available to support community-based alternative response programs. They're going to be available to support, expand, and create co-responder programs. Funding for the crisis system. So applicants are going to be able to apply for funds for crisis stabilization, mobile response, crisis respite care. And then also an exciting piece is there's going to be funding for enhanced staffing and facility improvements. So for example, You want to add improved security measures to a crisis walk-in center or stabilization unit. That's going to be an allowable expense. Another exciting piece is we will have funding for resource centers with a comprehensive service delivery approach. So you're looking at co-located services where an individual can go and get all their services needs met and get connected right then and there. So for post-arrest programs, we are going to have those program dollars be open to both district and municipal level cases. And we really encourage to have community collaboration. So we're looking at, if you have post-arrest, you have collaboration with a community-based organization and court-appointed counsel to ensure that during the early stages of arrest, as we know, there's a short window when someone's arrested, when you're going to have their attention, you're going to have their motivation. So we want to make sure that right away, they're going to have access to a behavioral health screen and assessment, care coordination to put in place any behavioral health services, ancillary services. We want to have a comprehensive pre-release plan for if they are incarcerated when they're leaving their incarceration, so they know where to go. That warm handoff has been made, and also care navigation. So if someone has upcoming court hearings or appointments, it's overwhelming. It's hard to figure out where to go, when to go, how to get there. If you have children, try getting on a bus with a stroller and making it to your appointment. So funds will be allowed for that piece. So dream big. It's really exciting to have this piece because it is, in my opinion, a gap that has been in existence. So you can request that in your application. Now the logistical side. So all applicants really need to aim to serve a high number of individuals with behavioral health needs. Now, with that said, we realize community sizes vary. Smaller communities are obviously going to have a smaller number served. Another exciting piece is there's going to be funding for capital expenditure. If you don't know what that is, that's, for if you need to make adjustments to your facility, whatnot. And the contracting team will go into a little bit more detail about that. Maximum number of the dollar amount for an application, sitting down, I hope, is $5 million per application. That's the maximum number. As an applicant, what you need to bring to the table is some type of in-kind contribution, and that's left fairly open. So that could be as much as office space, whatnot. So 2 or more entities can collaborate and submit an application together. And that is part of the reason why I wanted everyone to enter in the chat what organization you're from, because this could be an opportunity where you see, oh, that's something in my community. Let me reach out to so-and-so and let's work together. So things that you have to include in your application are obviously dollar budget amount, a description of your program and how this program is going to meet the goals of the grant, sources of your in-kind donation, resource, whatever the language you want to use. And then if your program plans to use 988, which is the new crisis response phone number, and then a description of sustainability, and sustainability, as we know, starts from day one, not when the grant is ending. So that will be in your application. Any MOU or partnerships that you have that will work towards meeting this goal, fun stuff, data collection, and your measures that you will use, demographic stuff. If you've done applications, I'm sure you have all this in hand, and outcomes. We want to look at how this is going to impact your community and make long-lasting change. Another piece that's crucial is in your application, you have to have a statement that services are voluntary and that you're not going to require any warrant checks, fingerprints for individuals to receive services. Marina, if you can go to the next slide. So what is the BHA going to offer you? Because this isn't just a one-way street. We are here for you. And we, for the first time in my time, we will be able to offer grant writing assistance. We're going to have limited ability to assist you in writing your application. And no, it's not going to be Jenny Wood doing this. We are going to be contracting with professional grant writers through the consortium through the University of Colorado. Now, if you have a $5 million application, I apologize, you're not eligible. It's for the applications that are less than $1 million. And again, it's going to be limited. And then once funds are awarded, the BHA, our office, is going to have a staff person assigned to 196, and this person will be available to you to help capacity building, support any implementation of evidence-based practices that you're exploring. We will be able to provide information in the form of marketing or point of access in regarding to 988. We are also going to make the promise to make our grant process transparent and publicly available and accessible via our website, and we are aiming to get that up by the end of the year. So there will be no questions in what we're doing. And my next and last slide is, what do we want to see happen? What are the outcomes? And really what we're looking for is individuals that have unmet behavioral health needs that would have historically been in and out of the criminal justice system are offered a new path, and their behavioral health needs are met with that whole person, whole care angle. And we're really looking at destigmatizing behavioral health. Like, if you have diabetes or cancer and you have a relapse in your disease, are you judged? Are you told it's a moral failing? No, you're offered another course of treatment. And we want that to permeate throughout our state. And if someone's behavioral health needs, there's a relapse, no, you're not a moral failing. We need to up our treatment, change things, tweak things. So we really hope that with this approach, the destigmatization and people that don't need to be in the criminal justice system are getting the services they need. And we also want to get the word out there about our 988 program too, and utilizing that when you have someone in behavioral health crisis. So thank you. And I am going to pass this to our contracting team.
Hello, everyone. Go to the next slide here. So I'm here to discuss some of the nuts and bolts of how to apply for the grant. So we have, this will be posted. If any of you have applied for a behavioral health grant before, or any Colorado state government grant, we'll be using the same system, the vendor self-service system. And if we can drop, if you can drop the VSS link in the chat, and we'll also include that in our materials afterward. So you enroll in the vendor self-service or VSS system. And if you're here, you will also be email notified that the grant has posted, but anyone who has enrolled in VSS and has marked criminal justice as a practice area, then you will also get notified through that program. So the grant application process on VSS, we will post what we call the request for application, the RFA. And that is our summary of what is this legislation, who are the eligible entities, what are the allowable uses of funding, and then we ask you questions. We pose, please describe your project, what kind of collaborations are you doing, what kind of equity measures do you have in place, some sort of standard grant application questions. So one thing that's a little different with this grant, we were interested to make this a really accessible, our goal was the most accessible grant we've had at the BHA. And one thing that we wanted to do for that is sort of simplify the process for for organizations who might not have a ton of experience in grant writing and making things very glossy and shiny. So we were doing an application response workbook to take some of the guesswork out of that. So all the questions that we need you to answer are going to be posted in a workbook that's linked to that RFA. So that's how we'll be accepting responses. Another sort of accessibility feature of this RFA, if you're used to a 30-day posting period, that will not be the case in this RFA. We are doing rolling application basis until funds are all used up, or until February of 2024, February 2024, whichever comes first. Sorry, I want to be totally sure I got that right. So we'll be, actually, if we could go to the next slide. Yes, so we're doing a rolling grant schedule to give people a lot of time to respond. We are going to take them down approximately quarterly, or not take down, but sort of collect applications and score those as a group, just to keep things moving so that people are getting contracts sort of in a reasonable amount of time. So our first soft deadline is January 15th. Any applications that we receive in that first batch are going to be awarded or declined by March 1st, with work to begin by April 28th. These are our goals. One thing that we're keeping in mind is there are 166 of you here. We are expecting a really massive response to this. It's going to be an unprecedented amount of funding to give out at once. So these are our projections of how long it'll take us to take down grants, review them, and have contracts in place. But these are aspirational. We are going to do our best, but just letting you know that these are projections. So when you apply for your whole life of your grant. This funding is live through December 30th, 2024. So if you're applying early, then your project, you can sort of project, you're looking at April 2023 to December 2024. You can apply for a shorter amount of time. If you have something that's really going to just take a year, that's okay. But December 2024 is our hard stop. If you don't make that January 15th deadline, then the applications are still going to remain open. We're going to leave them open until all the funding has been allocated, or until I have these 3 groups posted. There's actually a couple more. So it says more application groups may occur if additional funds are available. So if you want to absolutely make sure that you are in that first funding group, if by a really cool effort, we were giving out all $49 million in that first group, then you'd want to make sure you were in the first group. But I just, as the procurement manager, I am expecting that we will probably go for at least a couple rounds. So, and then the next aspect is, so Jenny mentioned grant writing assistance. We are going to have technical assistance for both writing a grant application and for program design, so that we have, we'll have a TA provider a technical assistance provider who can help you design a program that's in line with criminal justice diversion best practices. So these will be free programs for entities who qualify. And we're really looking to support organizations who don't have a lot of grant writing experience, or who are sort of getting started out, smaller organizations that don't have as many resources. So we'll have specific details about how to get enrolled with those programs in the request for applications when we post it. Then finally, the contracting process. So just looking forward, you've applied, we loved your proposal, we have awarded you a grant. You'll receive what's called a notice of intent to award letter. This does not constitute your contract. This says that we have selected you and now we're going to begin the contracting process. So just all the flashing letters, your notice of intent to award does not mean that you should start providing the services in your grant, because we cannot pay you until you have a finally executed either purchase order or contract. So once you do have that notice of award letter, my team will be reaching out to you and we will start the negotiation and contract execution process. It can take several weeks, especially considering the volume that we're looking at for this. So the projected rolling grant schedule posted here is our best estimates of how long that will take. And I think that covers it for me. I guess your first contract will be, all of our purchase orders and contracts follow the state fiscal year. So if you're in that first application group, you'll have a sort of short agreement that goes just from April to June 30th. But we will be, if your project goes for multiple years, then we will be renewing your contract on the appropriate schedule. And that's something that we'll reach out to you when it's time to get those rolling. Okay, now I think that is it for the contracting process. So now we get to dive into Q&A, and I know that we have lots and lots of questions, so very excited for that. So I think probably Jenny and I will be the main answerers as my guest here.
Kayla, we have, between Melissa and I, we have split questions. So I have questions that came from the chat, and then Melissa is monitoring questions that are in the Q&A.
Great.
I'd be happy to address the chat questions first. And then just for everyone else, if you do have a question that you haven't had a minute to type in, go ahead and click on the raise hand, and then either Kayla or Jenny will call on you. So are we good to proceed that way?
Yes.
Sounds
Okay.
good to me.
Great. Very good.
However, I cannot see who will have raised hands.
Okay, am I okay to stop sharing just so?
Yes.
Great.
You don't want to show our really lovely Q&A slide?
If you insist, I certainly can. Okay, so first question here I have is, which I think we've addressed that a little bit, but if attendees can get a copy of the presentation, and yes, the presentation and the recording of the webinar will be available on the website. We can also send a follow-up email to all attendees here today with that information. Second question, what was the dollar amount that is allocated to this program?
$49 million.
If you
And
want-
there's a maximum grant application per application of $5 million for the life of your project.
in the exact dollar amount, you can get a good laugh at my math skills, is $49,748,648, no cents.
In general, we are going with approximately 49 million because the grant writing and technical assistance programs that we mentioned are going to share that funding with you guys. So to support the program.
Great, thank you. Next question, are you accepting applications to serve on the review panel?
Well, yes, and if you are interested, Summer Gathercole and Sarah Lucas would be our contacts. However, with that said, if you've read the legislation, they call out specifically the roles of the review panel. So it's not going to be open to anyone and everyone. If that answers the question.
Thank you. Next question. Do you have a fact sheets that we can distribute that highlights the basics of the process?
That will be posted to our website with our, as I mentioned, we're going to be posting our grant process. And then also I strongly encourage people to refer to Senate Bill 22-196 Section 2. As the legislation has laid out the specifics of this grant program.
Did we already drop a link for that in the chat? If someone can drop a link to that, that would be like fabulous.
It's in there.
Gotcha.
Awesome, thank you. Then I have an additional question here. Lots of scrolling here. Okay, can you clarify the collaborating partners requirement? That two or more entities need to collaborate for an application. Can two separate departments for the same municipality qualify as collaborating partners?
I would like to clarify, it is not a requirement to apply as a collaboration. We love collaborations, especially on a grant this size, but it is not a requirement. And then can you, Marina, can you read the second part again?
It was about
who counts as a collaboration?
Yeah, it was about two municipalities applying. Give me 1 second. I have to scroll back. Oh, yes. Can two separate departments for the same municipality qualify as collaborating partners?
I think you could apply. So if it's like Douglas County and there's two different Douglas County departments, you could apply like as a collaboration or together. since there's not a requirement to apply as a collaboration, I'm not sure if that would, if that's as pressing of a question, but it would just depend on how you want to present your application.
Thank you, Kayla. And I have two more questions and then I want to get back to Q&A. I'm not sure if everyone is able to see Q&A here. But the question is, you spoke of the renewals. Is the 49 million available annually, or is it a one-time drop and then it runs out when it runs out?
The latter. So we have $49 million to go from the period now through December 30th, 2024.
Thank you. And when will the RFA be posted?
December 1st. I can't believe we forgot to leave to put that on a slide. Yeah, December 1st is our drop date for this RFA.
Okay, very good. Melissa, we can get back to you for the Q&As. I don't know if you had an ability to answer all the questions in there, or Kayla, we can take a look at those.
I don't think we answered all of them. There were a lot, and I made sure to close it when I was talking, so I didn't try to do both.
Okay.
And I didn't really answer them. I put them on the sheet and I can say them out loud now and you guys can answer them.
I can run through, and Kayla, I will call on you when it is contracting. So Webster asked, can we receive a copy of the presentation? Yes, we will post it to our website. Thank you all. Yes, again, we've asked to share the slide deck. Yes. Is this for youth and adults? Dream big. It can be adults, youth, family. Is there a written aloud funding detail? From Wendy. I'm not sure I'm understanding.
Probably
Yeah.
eligible uses and eligible organizations. If that's the case, right now, the best source of information is the Senate bill that we linked. It has both listed, and then our fact sheet that we'll be posting, plus of course the RFA itself will have those lists.
Next, Sarah asked, what if an agency provides services in multiple areas of support? Will you accept a proposal covering multiple areas, request separate proposals, or require an agency to prioritize? As far as I am aware, and from what I've read, you can, if you want to apply for multiple areas, go for it. You don't need to submit multiple applications. We're trying to eliminate some cumbersome steps. How does this support rural areas that are already struggling with lack of resources? How will rural areas be evaluated equitably since our numbers are low? As I said, when I made the comment about the high number to be served, we understand that rural, smaller communities, that number will be lower. And I think one piece that will help rural areas is the capital improvement component and the ability to use funds for facility improvements and whatnot. I think that will be really a big help for rural areas. Carrie, can we write as a region? Go for it. How long is the grant cycle? Kayla just answered that. December 2024, I believe is what she said. Mary asked, does your organization have to be a nonprofit organization to apply for this grant? I'm going to bounce that one to contracts because that seems like that's a logistical.
I've been reading through the eligible organizations list a few times. The only wiggle room I see for a for-profit agency, if there's an office that provides or coordinates court-appointed counsel to represent indigent clients charged with a criminal offense in municipal or state court, that is the only one that isn't either a government or a nonprofit listed from the eligible entities. So my first read is that no, a nonprofit or a for-profit agency would not be eligible unless it was in that sort of legal context I just mentioned.
Thank you. Next, Felicia asks, can funds be used for capital expenses to renovate an existing acquired building that will house a wages program, education and employment service, and other services that address the needs of persons with current or past engagement? I would say capital improvements allowed, just, be careful with grant supplantation and put that in your application, just to delineate the different funding streams and making sure that 196 are used for 196.
I'll give a caveat, or not so, a small caveat to the capital expenditures. If you're looking to do a capital expenditure over $1 million, we have to approve those through the governor's office and the Treasury Department, since these are American Rescue Plan Act dollars. So what could happen in those cases is we give sort of a provisional intent to award and say that we're going to take your proposal to the to that board to get approval. So that's one additional step, but you can apply for more than $1 million. It's just that we would have to do that step of approval.
Next is someone had put additional grant writing assistance can be accessed through the Colorado Consortium as well. That is actually who we're contracting with. So that's what we're going to be working with. The next question is, when you say 2 or more entities per application, does that mean it can't be a single entity? No, it does not. We just encourage community collaboration because we're really looking at the lasting impacts and communities working together to bring all their resources. The next question we answered, will grant applications be limited to nonprofit? And Gina asks, can you back bill for reimbursement to the date of the grant award to allow for early startup?
Unfortunately, that is a hard no. It is absolutely not possible to do that. It has to be the day that your contract or purchase order is signed. Well, purchase orders don't get signed, but when we say it's executed.
Are federally recognized tribes eligible to apply for this funding? Kayla, I believe that's a yes.
Yep.
Is this RFA already posted on the VSS? We answered that. We're looking at December 1st. Do applications have to be entirely new programs, or can they be used to supplement and expand? No, they do not have to be new. They can be used to supplement and expand. Next is, does the required in-kind contribution from the agency have to be a new capacity, or do elements of the existing program work for in-kind? I would say it can be existing.
I think so too, yeah. And to cover, I know we've got a few questions about match. So this is going to be best presented written, but if you are a organization with a $20 million budget or above, a large organization, then your match amount required would be 5% of your award amount requested. If you are a small organization, meaning your budget is less than $20 million annually, you would be matching 2.5%. And then if you are requesting $50,000 or less as your total grant project, then no match is required. So yeah, again, that'll be best presented in writing, but that's the general.
Next question is going to be for contracts. Is this funding based on a reimbursement model? Will agencies have to submit billing on a monthly or quarterly basis?
You can apply either as, depending on your project, either as a cost reimbursement basis or a deliverables based basis. If you have a project that lends itself to, being paid in stages like that, that doesn't really work as well for services contracts. In general, it is that you incur the costs for a month and then you bill us for reimbursement for those costs. Fiscal rule generally disallows prepayment, although in some cases with, I know our jail-based program where we have tiny jails with small operating budgets, we've been able to get fiscal rule waivers, but the general guidance is that it needs to be on a cost reimbursement basis, billed monthly.
Thank you. Next question is, can you clarify the services must be voluntary requirement? Would programs that serve mandated clients be ineligible? I'm going to say, so coming from my background working with probation, and I previously worked in a program that was voluntary with mandated clients, I think you can frame it in a way where you have a statement that says this individual is participating voluntary, because that has to be in there. That's written into the legislation. There's no wiggle room, but I think it's how you handle your program management aspect side of things. So if you have it where if someone doesn't participate, their parole, probation, whatever it is going to be revoked, then I would say then you're really making it involuntary. So you can add something that has a signature component where a client says they're voluntarily participating and you also can't have warrant checks and all of that be part of background checks, be part of participation. Next is if an organization is denied during group 1, can they reapply?
Yes, they can.
For people in the competency process, do the dollars have to be used to support the competency work already being done? I would say if there's other funding for that, then no. I think with grants, we really need to be careful to not supplant and get into that. So if there is another funding stream, then no. When will the grant application be open? We answered that. Is the 4.5 million in the governor's budget for co-responder programs going towards this by chance?
I believe that's separate.
Yes. You mentioned funding needed to be matched in kind. Is there any amount requested? No, there's not a finite dollar amount.
Well, there is a 2.5% if your budget is under 25 or under 20 million, 5% if it's over 20 million, and if you're applying for $50,000 or less, you do not need to match.
Please share the contact information for the review committee. Is there an amount percentage requirement? We answered that for in kind. I think.
We have what are you doing to center equity? So in the process, we wanted to make sure the grant application process itself was accessible and equitable. Things like doing a longer deadline, having a grant application workbook, which is going to take out some of that, like, well, I don't have the money to provide this really glossy, fancy report with tons of clip art, or not clip art, what do I call it, stock photos. So the grant, that's some things that we're doing on our end to level the playing field for small and large organizations. Then also in the applications to determine, it is a focus of ours to make sure that equity, diversity, and inclusion are really centered. We have some questions that have relatively strong weights. I can't tell you what they are right now, but that are addressing what an organization does to address those in their programming. How are they reaching populations that need it? And then the review committee itself, when you take a look at the community member, this review panel is pretty laid out in statute to have a really diverse group of people looking at these applications with different lenses. So those are some of the equity measures that we have for this grant.
Yeah, I also have a couple of questions in the chat, if that's okay, if I can read them. I want to make sure we didn't mix them. So there's a question about, can a new nonprofit agency apply to be partnered with a for-profit agency?
I would like some more time with that question. I wrote that one down because I think partnering with as dual partners, that wouldn't be, if both the partners don't qualify, then that wouldn't work. Although what came to my mind is if, an organization is partnering with some kind of like medical, or like a medical provider that's a for-profit agency, as a subcontractor, is that different? So I would say no to like a grant partner, a grant application partner, but as far as like subcontracts, I want to look into that. So I think for question, I don't know that there's many of them, but for questions that we aren't going to answer today, we can get the contact information of that specific person, but we can also include that on part of the grant application process is a question and answer document. So you submit questions, and once per group, we'll answer all of them together publicly. So if nothing else, it'll for sure be on that.
And can for-profit organizations apply for the grant?
No, we cannot.
Okay, thank you. Another question here. Will match dollars have to be from private foundations, or can it be other sources of government funding or payments from Medicaid?
It just, statute just says a monetary contribution or in-kind contribution to support the services. My instinct is that that would mean other payers counts, but not that it has to be other private foundations.
Okay.
Any other questions that people have hanging before we wrap up? We are approaching our time.
And just to keep in mind, important dates is that December 1st is when the RFA will be posted. The information from today's meeting will also be posted on the website, as well as kind of process, and all of the other information will also be posted on the website right when the RFA gets posted as well. So around December.
To all of you, and as I mentioned, I strongly encourage you read section 2 of the Senate Bill 22-196. That will be your guidebook. Have a great Thanksgiving and a holiday, and we will talk.
We have one more that we just got from Jeff Wise.
Yeah.
Can funds be used to support a broader re-entry program initiative, which will feature a mental health component, or do they need to be explicitly directed at mental health, behavioral health programming? I think, Jenny, in general, I mean, I think a question like that, if it's fitting within the eligible uses in the statute, then that's really your hook. So in your application, you're making the case that it fits in one of. I've been muted. Was I muted that whole time?
No, you're not. And
okay,
then
my computer probably got crazy.
latter part is, does peer mentoring coaching qualify? Go for it.
Yeah,
like I said, dream big. This is really exciting, and don't limit yourself, but read 196.
Excellent.
Thank you all. We will conclude today's meeting. Good luck.